Welcome everyone to another Flex University event. My name is Josh Graham. I'm the sales supervisor here for our group markets. Today we're going to be discussing sales strategies for open enrollment this year for 2016, a guide to retaining and growing your business. Obviously, I know a lot of agents in the marketplace are struggling with all the changes on the individual plans and how to create groups and what are my clients' best options. So we want to take a look at that today to kind of help you through that process and give you some ideas that might help you through your sales efforts. So our agenda this morning, we're going to be looking at really our current market conditions, some of the causes for these market changes, and then obviously the proposed solutions within each one of the markets, both individual and group. Really in our current market conditions, you really are going to see some significant trends, all relating back to the cost of these particular health plans. Large PPO networks are being eliminated, and we're seeing a shift into these open access HMO-style products. Some give you more freedoms than other, but all in an effort to control cost. We see some significant hospital and provider merges, such as North Shore and Advocate coming together as one. You've got Cadence and Northwestern. So really an effort for hospitals to as well, control their costs and assist with some of the negotiating power with the insurance companies. You also see hospital providers partnering with insurers. So you've got ACOs, or accountable care organizations, in which hospitals and providers are rewarded for better outcomes within their patients. One example of this would be the new Blue Care Direct products, which we're going to talk about with Blue Cross and Blue Shield and Advocate. There's also the Aetna Whole Health products on the individual market, which is a partnership between Advocate and North Shore, and then some additional enhancements to that network on the group side coming in April 1. Within the current market conditions, you see some insurer mergers as well. You've got Aetna, which combined with Coventry a few years back. Aetna is now working to combine with Humana, which based on everything we can see is going to go through. You've got WellPoint looking to combine with Cigna, which could create one of the largest insurers in the country. So once again, all of this is in an effort to control costs, and left in the wayside are some of these smaller carriers that may not be able to really compete in the market as these larger insurers continue to merge and combine into one. Many of you have probably seen a lot of the news with co-ops struggling in the marketplace. Only 12 of the 23 co-ops are still standing. The co-op here in Illinois, Land of Lincoln Health, also is struggling quite a bit, but looks like they are still doing business for 2016. Within that current market condition, you've got health insurance rates that are really just on the rise, increasing more than we expected. We don't have a lot of control with this because the cost of healthcare is up, obviously, and the insurance companies cannot decline business, so they have to take all of that business on. So it's been a challenge for them to control the risk within that market. We do see that small group rates seem to be stabilizing, which is a nice thing to see. We also see that more individuals are trying to create groups and go back to group business in order to still have access to some of those larger networks. In order to control costs, the carriers are getting creative with the benefits, so you do see some of the benefit reductions happening within the marketplace. As I mentioned, the risk within these groups seem to be a little bit more controllable. And one thing we've really seen across the board are pharmacy changes, some changes within formulary status or what drugs are covered in certain formularies. There are less medications that are coming onto a generic tier over the past year and a half, and anticipated within the next 2 years, even less to come onto that generic. So it just means that there's a higher spend that's going to happen within that pharmacy market. Many of you may have seen some of the pharmaceutical companies coming out with these new hepatitis C drugs, close to $80,000 per person. So it's a very expensive medication, yet it eradicates the disease. So it's absolutely medically necessary. But all of these types of situations are really causing our pharmacy spend to go through the roof, and a direct reflection to the members' premiums. We've seen some statistics say that by 2017, our pharmacy spend could be roughly 30% of the overall premiums collected. So in an effort to control that, you'll see some of the carriers move to more of a specialty pharmacy where you have to go to preferred providers to get those specialty medications. Once again, all trending towards controlling cost for the carriers as well as for the members. Rates and plans have been unavailable for some carriers on the marketplace when it first opened. That's obviously put a hitch in our efforts as brokers to quote the products. The DOI has been part of the issue with getting rates and plans approved. Some insurers just were not ready. So it's kind of a perfect storm with all the craziness that's happening in the market, the changes, the plans not being available. It's been an absolute challenge for brokers, general agents, and members trying to get a rate for 2016. Some of the causes for the market changes continued here: higher than expected claims. We anticipated, Blue Cross anticipated, all the carriers anticipated that the claims were going to be high and through the roof. But they really didn't expect the claims as significant as they did come through. Obviously, under 65 individual policies on or off exchange, there is no medical underwriting. Small group policies, there's no medical underwriting. There's really minimal controls available to manage the cost for these insurance companies, and the sick uninsured just completely shocked the system. You had people just waiting to get organ transplants at the beginning of 2014. As soon as they had access to that quality health insurance, they got those transplants, and a lot of the carriers took on that risk. So it's been a struggle. Managed care becomes a new focal point. As I mentioned, accountable care organizations or health maintenance organizations, narrow network PPO products to help control the cost. Obviously, different contracts for those providers to accept patients, which helps really the overall premiums that need to be collected within those policies. The quality of care is really our key driver now. So within a provider, if you're able to take care of a patient and limit their readmission rates, you do see increased reimbursements from the insurance companies. So managed care becomes a new focal point. As many of you remembered HMOs back in the day, those are going to become more and more prevalent here within our markets. On top of that, you've got government funding that is really lower than originally projected. For co-ops in particular, the funding is down significantly. And for example, Land of Lincoln, they're estimated to be owed close to $47 million here for 2015. They may not get any of it. And for a new startup company, that is devastating. So you're seeing a lot of changes within the market from them and things that they're doing to help control costs. Whether it be from network changes on the individual side or potentially, commission changes for agents. So really just a lot of ways to help control the costs. I think they're actually limiting their enrollment for 2016 to help really keep them at a reasonable level from a claims perspective. Carrier claims for federal state exchanges are exceeding the risk corridor funding. So many of you are familiar with the health insurer fee and the reinsurance fees. These were basically funded by group markets and set forth to help reimburse for that bad risk that the carriers were going to take on regardless of the underwriting practices. And, based on that bad risk, they could get a percentage of it back. Well, the funds are low, and they're really only expected to get 12 cents on the dollar of what they had originally expected. So smaller health insurers are going to struggle when they don't get any of that dollar back. Lucky for them, we did see that Blue Cross probably took on 90% of the business over the past couple years. However, for those smaller carriers not receiving some of that funding for the risk they did take on, that is going to be a struggle. We also see a lack of cooperation and communication against government entities and insurers. For instance, CMS is causing the DOI, which is causing insurers to be reactive and what we would call late to the party. Rates were not available. Plans were not approved. You may have seen just recently, Aetna in the last couple weeks has only come out with their products for the group marketplace. So that's caused a big challenge for us in the brokerage community. We're kind of on our heels at this point, trying to just make it through open enrollment and assist our clients as best as possible. But all of these things are really causing some challenges within the marketplace. But with challenge comes opportunity. We have to change and really help our clients identify what's available for them in the marketplace and create a positive outlook for them There's still going to be guaranteed health insurance. There's going to be options out there for their clients, and you need to be a guide for them to help them through that process. I can tell you that no matter what the situation is, there is some sort of a solution for those members. If it's a network product, we have some network options. If it's a pricing product or a pricing issue, we have some options for that as well. So stay positive, be a student of the health insurance marketplace right now, because obviously that is how you're going to best advise your clients. So we'll take a look at a couple solutions from an individual perspective. We know that many people are trying to retain a large PPO network. They're trying to control their overall costs when they retain that large PPO network. And they don't want to degrade those benefits too much. They want to maintain that quality of benefit. So looking at our different insurance companies here today, Aetna Whole Health product for the individual market. These are HMO plans via an Advocate and North Shore network. So many people that are losing that that full PPO networks with some of our other carriers may only be utilizing these facilities and could be a very good option for them. You may have seen a letter that came out from North Shore, for instance, that basically said that if you had an individual product through Blue Cross, you're going to be losing that network, and therefore you can enroll in an Aetna Whole Health product. That's all in an effort for them to retain that business. It's really focused on that quality of care, as I mentioned, to help keep people out of the hospital and keep them healthier. There's also, through Aetna, some large PPO networks available with Coventry. Coventry is that sister company that Aetna purchased a few years back. They are going to have the largest network here in the Chicago market for 2016. However, from what we can tell so far, you will be paying for that network. Some people are going to pay for it because they need it. Some people are going to avoid that because of the cost. However, there is an option there for that full PPO network. Within Blue Cross and Blue Shield, you've got the Blue Care Direct product. This is also an HMO plan via the Advocate network of hospitals. So we're talking roughly 10 hospitals and 4,000 physicians with almost 250 access points to that health care. So it's still a very significant network, and for a lot of people could be a great product. It is going to be Blue Cross's most competitively priced product in the market, and it really focuses, once again, on coordinated care. So keep an eye out for that. If you haven't seen anything about it, it is a pretty attractive program if you're able to maintain that network status. Within United Healthcare, there's another company, a subsidiary called Harken Health, and really this is a new approach to the health insurance market. First of all, it's only going to be available for individuals that reside in Cook County, so you got to keep that in mind. But you will receive unlimited care at 4 of their health centers that are located in the Chicago market. If the member needs to go outside of those health centers, so these are like a clinic, if you will, I would call it a new age clinic. It's not what you would typically know as a clinic. It's basically all your physicians are going to be available. It's not like you're waiting in line. You basically go in and see the physician that you need to get service from. But you will have access to the full Choice Plus network if you needed to go see a specialist. So if you needed to go to one of those teaching hospitals, you would still have access to that. Now, you typically pay out of pocket from a deductible perspective up to a certain level, and then the coinsurance would kick in after that. So you wouldn't have any copays outside of that particular Harken network. However, you would have a stop loss and out-of-pocket maximum that you would be required to pay, and then 100% coverage thereafter. In addition to that, United Healthcare, UHC, UH1, if you will, their PPO products, they've got 10 off-exchange and 25 on-exchange plans. The on-exchange here in Illinois, they're in 27 counties through Compass. You'll see a Navigate Plus product, which is actually going to be available in all counties here in Illinois. So they have some good options for you to investigate as well. If you have any questions within the individual solutions here that I presented to you, please feel free to contact our office and ask for an individual sales representative. Now, our group sales team is taking a lot of questions from agents in regards to, what network are available in the group market. Are they eliminating the full PPO networks in the group market? Really, our networks are going to remain, very, very similar to how they were in 2015. Some slight changes. But within the group market, we're looking to, really provide a competitive employee coverage. You want to help retain and eliminate turnover within your corporations. You want to retain that large PPO network as an option, which may not be available, obviously, as we talked about on the individual market. You want to control the costs as well as the quality of that health care, and really simplify access and delivery of these benefits. We need to be more efficient as a broker through that process to help us remain profitable here moving into 2016. Now, one example of this right away is Blue Directions for small business through Blue Cross and Blue Shield. This is an online process from quote to welcome letter. It's completely electronic now for 1/1/16, so I can do ACH drafts for billing. They can do online enrollment for applications. It pre-populates the employer documents. All of it 100% electronic for you to help save time. It really is going to help provide choice with a simplified decision process. Side-by-side comparisons, you know exactly what your cost is on a monthly or per paycheck period for an employee. We can offer up to 6 different plan designs within this process, and the employee makes the election online on their behalf. So it really helps through that enrollment process. In addition, many of you may be familiar with some of the digital companies out there that are competing for our business, such as the Zenefits. Having an electronic enrollment platform and simplifying that enrollment process can really help keep the competition out. Obviously, they're offering up free HR services in response to receiving a BOR notice. They're really shaking up the industry, but they'll find out very quickly, they're getting sold a bill of goods potentially as you come into renewal years and things like that. But, avoiding that BOR letter, using some of these online enrollment capabilities can be a huge deterrent for them. Obviously, a tool for you to retain that business in 2016. Blue Care Direct, as we mentioned on the individual market, is also going to be available within the group market. As we discussed, it's an alternative product designed to control the cost while providing quality care. This is through the Advocate hospital facilities with roughly the 10 hospitals that we mentioned and 4,000 providers. While it is built on an HMO chassis, you can call today and be seen today. So you can go and see a physician at any of those Advocate facilities without having to wait for a primary care physician. So while it's a smaller network, it still has that kind of PPO feel, if you will. But you do have to stay within the Advocate facilities or you will have no coverage outside of an emergency. For Aetna, they have some new offerings in the small group marketplace. They're offering a composite rate for 1/1/16, which some of the other carriers are still looking into. But you have the option to be billed both a composite rate or you can be billed an age-rated process. Right now, as the quotes come out from Aetna, obviously they were delayed at the initial onset, but as they come out, you'll see them in composite. If you do want to see an age-rated product because your clients are now used to that after the last couple years, you can go ahead and request that from us. We'll go ahead and send the quote off to Aetna to get that updated to an age-rated process. They will have a new product available for April 1st of 16. Like we talked about, the whole health product on the individual market is going to be very similar with the addition of Rush. So you'll have Rush, North Shore, and the Advocate hospital facilities within one product. So that, I think, is going to be a very attractive program. We have not seen any of the pricing yet, obviously. So as soon as we know more about that, we'll introduce it into the market. But keep your eye out for that. I think that will be a pretty attractive product for many employees. United Healthcare, within their market space right now on the group side, I would tell you that All Savers is probably the most competitively priced product for them. Obviously, it still is an underwritten product. This is a level-funded program. You would collect applications. It breathes fully insured to an employer. Employees don't know any different. But at the end of the day, with level-funded products, if you're familiar, if the group runs very well, you will automatically receive a refund based on the surplus. So if your claims were lower than expected, they'll return that money to you. This program also allows for an online application process. So, we talked about, having to collect applications to underwrite. You can actually do that all online. For any employers that are trying to avoid these adjusted community rates, your age rates out there, this type of program is absolutely going to do that. If you're a younger, healthier group, this is absolutely the way to go moving into 2016. Now, on top of that, as we talked about higher deductibles, higher out-of-pockets, degrading some of the benefits, HRAs, health reimbursement arrangements, which is an employer-sponsored account to help with employees' medical and dental and vision expenses, potentially. You've got health savings accounts, which are there to really pair with those high-deductible health plans that are qualified to do so. And then obviously flexible spending accounts for anyone else that has unreimbursed medical expenses. All of these are tools as these deductibles and out-of-pockets go higher. Paying for some of those expenses on a pre-tax basis is going to be a huge advantage to many individuals out there in the market. So offering some of these, many of them, are really going to cost the employer little to nothing, but it is a vehicle for a tax savings for that particular employee. Now, within the Flex General Agency, we do have our TPA services, which we can offer health reimbursement arrangements in which we get a direct claims feed from Blue Cross and Blue Shield called Crosstex, so members don't have to complete any type of forms for the reimbursement. We are one of Blue Cross and Blue Shield's HSA vendors, so you will see us on a BPA, or excuse me, on a benefit program selection form. You will also see us on the retail shopping cart. So you'll find us there. We'll help you with this. Give us a call. More than happy to kind of walk you through the impacts of having these programs to a business and to the employees as well. So with that, I'd just like to let you know that we're here to help you. Please feel free to contact your sales consultant so we can help you through this process. I know it's a challenge for many of you. Like I said, be a student within this program. Understand the health insurance marketplace. You have to read what's going on in the market. Feel free to contact us at our toll-free line at 888-353-9178 or our main office line, area code 847-699-6900, and you'll be prompted to reach out to different departments within our organization. If you do want to send us any emails, our group sales department can take emails at groupsales@flexiblebenefit.com or indsales@flexiblebenefit.com for the individual under 65 sales representatives, or the Medicare department at medicare@flexiblebenefit.com. On our website at www.flexiblebenefit.com, you will find a lot of resources for you as brokers. We have these recorded videos, as you know. We also will provide a lot of the applications and summary benefits and coverage, answers to simple servicing type questions. How do I get a temporary ID card? Things like that. So utilize those resources. We spend a lot of time getting that together for you. So I want to thank you once again for joining us for a Flex University event, retaining and growing your business in 2016. We look forward to helping you through that process, and please feel free to reach out to us with any questions. Have a great day.